And I just wanted to kick us off by talking a little bit about this project that Dr. Sumi Sinha did. Unfortunately, she's unable to be with us today, but had some really cool things to present. So this is a project about sustainability of expanding an interprofessional education program that really was about medical assistance after 4 years of experience in it. She had no disclosures, really, and I don't have any either. Medical assistants are very critical to our clinic. They're really important in terms of helping patients get to where they need to go, and often are ones who can identify things that are going on with patients even before we see them. There are few programs that are available for them to actually educate medical assistants once they're hired, and particularly in radiation oncology. In 2017, one of the residents of the program basically began this radiation oncology program that was specifically teaching medical assistants critical information about how to, adequately sort of work with radiation oncology patients. So what they ended up doing is they did a needs assessment of the medical assistants, and then they developed this 20-month curriculum with each of the lectures having a pre and post test. The lectures were offered monthly and basically went through different topics. So the first one started with just introduction of clinical oncology. They reviewed basic things like vital signs, triage, medications were reviewed. And then there was all these sort of disease site-specific lectures that gave them an introduction to what the anatomy of those things were, what the imaging modalities, and also what the tumors look like, and maybe what some of the treatment patients might be going through and what their side effects were. And then other things to round out in terms of how to make sure that we have some safety, that we are doing things in a way that's safe, how we think about nutrition, and then hands-on experience of actually getting in the room in terms of understanding how simulations and setup was done, so that they could actually understand better what they're basically helping patients through. And then quarterly surveys were conducted in this as well. So cycle one was done 2017, 2020. It was predominantly resident-led. So there was basically residents here who ended up teaching the MAs. We had about 5 to 7 MAs that participated in the program each year. And the survey found that the program was, that MAs found the program consistently comprehensive, innovative, and empowering. And then this last cycle that we just did, one of the things that we've been working on is actually to engage other interprofessional part of our team into education. So nurses, dietitians, and actually teaching the lectures to the medical assistants that are related to the area where they actually practice. So we had, a little over half of the lectures taken over by those. The MA program has expanded to include 7 to 8, and that number is even bigger than that because it's people who've left and people who've come. So there are even more people who've sort of been touched by that. And despite the challenges with COVID-19, we've been able to really keep it going. So one of the things that we did in the pre versus post was really to assess basically how confident the MAs felt in each of these different domains. And what we're showing here is a change in the Likert score from the beginning to the end of actually this. And so you can see there's actually, across the different topics that we talked about, there are many areas where the medical assistants actually just felt much more capable and confident in working with patients and guiding them through their care process. So where we are right now in this is that we've demonstrated that this is feasible, it's been sustainable. Our medical assistants really enjoy it. They dedicate an hour each month that we've set aside to actually work with this. And then we've also shown that we can incorporate interprofessional instructors who are able to teach the information being emboldened in that process as well, like basically allows them to be a much more active participant in the team and allows us to think about something that residents don't often get to do, which is to really work with a variety of providers and making sure everyone's being educated. Our next goal for this is to actually start to expand this to other institutions. A lot of this is actually done virtually. So there's the opportunity to partner with other institutions. And so if this is something that you think your medical assistants would definitely benefit from, we'd be happy to talk to you more about the program and invite you to join this.